Are you or your partner snoring? Well, it could be a sign of obstructive sleep apnea, a dangerous condition that affects your heart and could affect not just the quality of your sleep, but could also affect your life and your partner's life as well. Well, here to talk about snoring, aka sleep apnea, and its signs and symptoms and treatment options is HCA Florida Memorial Hospital otolaryngologist Dr. David Carlson. So good morning. Thank you for being here.
Oh, great to be here. Happy.
All right. So my first question is, what is obstructive sleep apnea for those that don't know?
So great question to start off with. I think it's important for us to differentiate between sleep apnea and snoring. Snoring is the noise that we're all accustomed to, especially over the last two years with the pandemic, that's coming from our bed partner, our spouse, someone in the home that's causing some disruption in our own sleep. Sleep apnea, however, is a little bit different. So this is an actual cessation of breathing or blockage of airflow from collapse of soft tissue in our airways. This can occur for periods of as long as 10 seconds. Those periods typically will cause a drop in our oxygen levels, our carbon dioxide levels will go through the roof, and our brain will finally go on alert and wake us up. So these situations will cause a very disruptive or fractured sleep pattern. So patients don't get restorative sleep. So these repetitive cycles can happen upwards of 30, 40, over 60 times an hour. So patients with this sort of situation are dealing with some very significant challenges in their sleep. So these blockages of airflow, these drops in oxygen, the carbon dioxide levels going through the roof are what are called sleep apnea.
Wow. So is snoring the #1 sign, or are there other signs as well?
It's a great question. So typically the classic sign of sleep apnea is snoring, but there can be other signs or symptoms. It can be choking or gasping episodes. Some of my patients deal with a lot of daytime somnolence or sleepiness. That can create some significant challenges as far as their work, driving. A lot of patients are at risk for motor vehicle accidents because of this. We have patients who deal with morning headaches, difficulty concentrating. Cognition is a real problem for patients with sleep apnea. It's hard to think, brain fog. A lot of patients will end up with lack of sex drive. We have some patients who can't control their diabetes because of sleep apnea. All these are other potential signs or symptoms of sleep apnea.
Wow. So I know a lot of people might just think, maybe I'm just sleep deprived because of work, or I'm just doing too much. How do you know specifically if you have sleep apnea? Like, when should someone decide to get tested?
Yeah, so I think if you're suffering from some of these symptoms, you're saying, I'm having trouble sleeping, staying asleep, I'm constantly tired throughout the day, it's time to come in and get a test that can look at whether or not you are just dealing with sleep apnea or snoring.
Wow, okay, so is there an age group that this mainly affects, or can this happen to anybody?
This can happen to anybody. We have pediatric aged patients who are coming in and dealing with sleepiness and tiredness and fatigue and are dealing with sleep apnea. I have patients in their 90s who are dealing with the same sort of scenario.
Wow, and I'm curious to know, could effects of sleep paralysis be tied to sleep apnea as well, or are those completely two separate things?
A little bit different. So a sleep test will typically bear out what type of sleep apnea you have, but patients a lot of time will come to us saying that they have insomnia when really it's underlying sleep apnea.
Wow. So what are some of the treatment options for sleep apnea?
So this is an interesting topic that's been on the news a little bit more. Classically, the way that we treat sleep apnea is with CPAP. It's the hose and mask that gets attached to your nose and mouth that pumps air into your airway and helps keep those blocked airways open. Works tremendously well. Only about 30 to 40% of patients can actually tolerate that mask, though. This device was also in the news recently because of a recall of one of the companies, because the device was actually breaking down and pushing particles into patients' airways and windpipes. And so we've had a tremendous amount of patients who've been coming to the office who've been asking for alternatives to CPAP.
Okay, so is there any way at all to prevent it, or does it just happen?
So for some patients, prevention can come in weight loss or some significant changes in habits. For a lot of patients, there's really not much else they can do. It's an anatomy issue. They're dealing with blockages along the tonsils, the nose, the back of the throat, the back of the tongue, and those are scenarios where they're not going to really be able to do too much.
Okay, so you kind of just have to take it day by day and just really be in tune with your body, essentially.
Yeah. It comes down to, at points, if you're having trouble, you're having a lot of fatigue, you've had sleep apnea, you can't tolerate that CPAP, you've become tired of dragging that thing on vacation with you, it's time to look for some alternatives.
All right. Well, thank you so much, Dr. Carlson. It was a pleasure having you on this morning, and I hope those at home who might have symptoms, this at least encourages them to go see a doctor.
Thank you.